Okay.
We'll be starting the meeting in a couple of minutes at 2 o'clock. All right. I have 2 o'clock, so we'll go ahead and get started with our weekly media and public update regarding our COVID-19. Tracy, if you want to get started.
All right. Welcome everyone to Wednesday, May the 13th weekly update for COVID-19 across the Lake Cumberland District. I'm Tracy Aaron, Health Education Director, and we have some members of our executive team who will be sharing, they will be answering questions that we've received over the past week. Before we start with the questions, I'm going to turn it back to you, Sean, and let you give us an update.
All right. As of today, we have had a total of 192 cumulative cases in our district. Right now, we have 32 cases that are active. 7 of those are in the hospital, 25 are on home isolation. We have had 141 of our 192 released from isolation or recovered, and we've had 19 deaths. By county, we've had 88 total cases in Adair, 1 in KC, 3 in Clinton, 5 in Cumberland, 1 in Greene, 13 in McQuarrie, 45 in Pulaski, 19 in Russell, 9 in Taylor, and 8 in Wayne. Just a few weeks ago, when we were really early on in our situation with COVID-19, we was watching as the cumulative confirmed cases was doubling between every 3 and 4 days. Our governor instituted a state of emergency on the first day we had a confirmed case in our district and started instituting some social distancing guidelines. It took about 3 weeks for us to start seeing the real difference in the statistics. And after that, we started seeing how quickly the case rate was doubling, start to slow down. It went from 3 days to 4 days to 7 days and on up to 25 or 30 days. Of course, that is with all the social distancing. Now that we're starting to open things back up and people are starting to get out some more, we expect to start seeing how quickly the cases double will start speeding up again. We have noticed in a few of the states that are reopening things, it looks like, as expected, their case rate is starting to increase. So, our goal, like it's always been, is to, we realize with this particular disease, we can't contain it, so we're trying to mitigate it, which means we don't want it to spread so quickly and make so many people sick that we overwhelm our hospitals and aren't able to give people the appropriate care that they need. So, there's a balance right now. Cases are just trickling in with all the social distancing. As we open up the businesses, more cases will come in, and that's expected. The balance is how much can we open and how much can we do before our case rate starts doubling too quickly, that we start getting worrying about overwhelming the medical system again. I hope everyone in our public has realized the need to social distance. I mean, the biggest thing that everyone can do is still avoid crowds, avoid being particularly inside in a room with a group of people for any length of time. If you have to go in, wear a mask to protect others and get back out. The governor's talking about healthy at work, which, you go in, you're still not supposed to be in a crowded situation. You're supposed to be staying 6 feet apart, wearing a mask. Those things are going to be really important. I hope that the public hasn't been lured into a false sense of security since our cases have really lowered. They are going to pick back up again. COVID-19 is still with us. It still spreads aggressively. It's still, the mortality rate for it is still pretty severe, particularly with the high-risk population. So we still got a ways to go with this. Still probably about a year out from any kind of vaccination. Maybe something can get fast-tracked quicker than then, but it's still going to be a struggle for a while longer. So I'll turn it back over to you, Tracy, with those comments.
Thank you, Sean. I do want to remind people that there is a chat box on YouTube Live. And if you have questions as we walk through the meeting, please type those in and we'll answer those. First question, I think this one is for you, Sean. Some churches are viewing the court ruling as a green light to hold in-person services this Sunday. Does the health department have official guidance on the subject?
I will try to answer this. Stuart might have a more in-depth answer than I have, but if he does, he's welcome to jump in. We realize the courts overruled the executive order and has ruled that churches can start having in-person meetings again. And, we believe that the right to religion is protected in the Constitution, and that's really important to our society. So the one thing we would encourage is, for churches not to meet until they feel like they can do so safely. There is guidance that's been generated by the governor's office, and that guidance, if you go to our website at Lake Cumberland District Health Department, just search that. On our homepage, there's a banner, the COVID-19 banner. If you click that, you can scroll down to the bottom of that page that it will take you to, and there's a link there for guidance for places of worship. So before anyone is meeting in person, review the guidance, make sure that you understand about all of the steps you need to take to keep your members safe. Church is a difficult environment. The people who attend church, their average age skews high. You're going to be inside a building where the air is not necessarily recirculated very well. You're going to be in that building with a group of people for, most church services last an hour or more. So that's a lot of time to be in a room with a group of people. So it's still a difficult situation. Stuart, do you have anything to add to that?
Oh, just to talk about some of the guidance. Again, as Sean said, the health department and the state health department still would recommend that churches meet alternatively, such as over internet or by doing drive-in services. But if churches are to get together inside the building, then we need to make sure that people are still social distancing with the 6 foot in between. We need to make sure that the building is not overly crowded to maintain that distancing. So probably about a third of the building's capacity just to be able to maintain that 6 foot distancing, and that's a radius around a person. We would encourage that everybody wear the face masks while worshiping, and also encourage that they not reopen to their Sunday school classes until the 15th of June. And we'll get some extra guidance on daycares at that time, and that can help with the churches. We know and we've seen that during singing, when people are projecting their voice, that that puts out more of the particles into the air. And so, you know, right now it's recommended not to have the congregational singing at this time unless you're doing the drive-in service. Taking temperatures would be something that a congregation could do and would be recommended, and not allowing those people in that has any kind of, that if they're sick, they need to stay at home. And if they have a fever, then they need to stay at home above the 100.4 degrees. They should not pass the communion trays or the offering trays at this time, and then make sure that there's sanitizer available and things like that for people to use in their when they come in, so they can sanitize their hands. If you're a church that has common areas like your gym or your fellowship hall, then would recommend that not open those up until we can better get through this. Again, churches are just a kind of a unique place, along with places such as maybe like a movie theater, where you get several people in a building breathing that same air that's being recirculated, and they tend to stay for an hour or 2 hours. So that's where a great amount of exposure could happen. So that's all I have on the churches.
Thank you, Stuart. Thank you, Sean. Next question, is the health department the primary organization undertaking contact tracing in the 10 counties? And if so, how many employees are currently working on contact tracing?
Right, I'll start by giving a general answer, and then Dr. Wayman or Laura can jump in if they want to add anything. Also, I see there's about 74 people watching live. I'll remind you there's a chat box in case you want to put in a question for us. We'll try to answer it if we can. The local health department is the agencies in Kentucky, in all 120 counties, that are doing the contact tracing and the case investigations. How many people do we have? Well, that depends on the day. If we have one new case, it would certainly take a lot fewer people to deal with that on that day than it would be if we had 10 new cases. So we have up to 40 nurses that we can use to do some version of that. We have other staff that can also be used to help with contact tracing. And so, you know, we have quite a few people that's trained, so we can deal with quite a lot of new cases per day. I know the governor has plans to hire some regional employees to help supplement us, and we will welcome the support. Our anticipation is that the new cases will start to increase again as the economy opens back up and people are getting out and about. At the same time that's happening, we will be returning to some of our normal services as a health department. And some of the staff that we would be using when we were all shut down, that we were using to do the contact case investigation, well, we may be having to pull them out to go back and provide traditional services. So having some of those additional employees through the governor's program will very likely be quite welcome and helpful in that circumstance. Laura, Dr. Wayne, do you have anything extra to add to that? Okay, thank you. Tracy?
Thank you, Sean. What about, okay, I'm sorry, let's see. Why does the health district not announce or release ages of positive cases in each county? It says the governor announces that, he announces that in his announcements daily. And let's see, one of the recent cases in Macquarie County was a 17-year-old male. If he can announce this information, why can the health district not do the same?
Now, it's not really a matter of whether we can or can't. You know, we realize in these small communities that when we announce someone's gender and their age, it may make it really easy to narrow down who it is specifically that has tested positive. And, you know, we try to protect people's individual identity as much as we can. You know, I realize the governor is going to, he may not announce everyone's name and age each day. He does a lot of days, and there's some additional links on his website where you can open a report that's got, you know, the cases by county and the age and the gender. So, you know, maybe we ought to go ahead and start announcing that since we know it's going to be announced by the governor anyway. Maybe we will do that. And, you know, again, the reason why we haven't done that is just because we know we live in a small area where it's pretty easy to track down who someone is. You know, I know people sometimes assume if they know who someone is, they can be safer if they have that information. And, you know, that is not entirely true. If we know of a positive case, we've already asked them to isolate, so they're going to be away from the public. You know, what we would prefer the public to assume is that this disease is widespread and that people you are seeing when you go out have it, and that you're doing things to keep yourself safe. We know as the economy opens back up, not everyone is going to take the guidance and the recommendations seriously. There's going to be a certain group of people who thinks it's all a hoax, that it's all made up, or they're just rebellious, or they're just not using good judgment. And they're going to go out there and they're going to do just what they want to do. Well, that puts everyone in harm's way, because you can certainly be spreading this disease and not even know you have it. So I hope that as the economy opens back up and people are getting out, that each of you as individual citizens will take it upon yourself to protect yourself. And what I mean by that is avoid crowds as much as you can. You know, just because you can be around 10 people or 20 people, you know, at certain dates doesn't mean that is the preferred thing to do during a pandemic. You know, to protect yourself, you should avoid crowds as much as you can. And when you're out, grab what you need and get back. You know, wear a mask while you're out. You know, the mask is really to protect others from you. But if everyone's wearing a mask, everyone is protected. So, you know, the more people wearing a cloth mask or a homemade mask when they're out, the better. So do things to protect yourself. Don't be lulled into a sense of security thinking that this isn't serious or that it's been overblown or that it's behind us. You know, we're just the entire world basically adopted some form of social distancing over the last few weeks. So as the whole world opens back up, this is going to start spreading again.
Thank you, Sean. Next question. What about testing and case numbers from the penitentiary and the federal camp in Macquarie County? Are those numbers available?
Generally, the federal prisons, as far as, you know, handling whoever is sick inside their facilities, they take care of that. But we are notified of any positive cases, and they reflect in, you know, any county's numbers. Of course, we only have the federal prison in Macquarie County, but if there's any positive cases in the federal prison, they are reported in that county. So that's really about all we do with the federal prisons. We may exchange some information with them from time to time, but they generally are self-sufficient. But the numbers do reflect in the county that the prison is in.
Ms. Carol Huckleby, 1125, Carolyn.
Sorry about that.
Was that on your end, Tracy?
It was on my end. I apologize. I'm taking care of it now.
Hey,
Next question.
It's live. What can you say?
I apologize. And thank you, Sean. Next question. Is there any location in the district that's doing the antibody test right now? And if there is there a charge for that test? And then there's another part to the question also. If you have antibody tests, can you donate the blood to a specific person who has COVID-19?
Okay, so this one's for me. Both LabCorp and Quest, which are two big labs, are now doing antibody testing. They received emergency authorization from the FDA. These are blood tests. These are blood draws. These are not rapid tests. Any healthcare provider can send off a test on someone who thinks they may have had COVID-19. To my knowledge, there aren't any drive-through rapid testing going on in our district. If you have had the disease and you are antibody positive, you can donate plasma, and you can do it in Somerset. You need to go to their website, kybloodcenter.org, and fill out the questionnaire. They will call you and set up a testing, because they will retest your antibodies, and also they're going to make sure that you do not actively have coronavirus. No, you cannot direct the plasma at this time to any individual person. This is a bit more complicated right now, and only certain people meet the criteria for treatment with convalescent plasma. Thanks.
As far as testing goes, so the situation with testing has evolved every week over the last 7 weeks. At the very beginning of the COVID-19 outbreak, testing was extremely, extremely limited, all types of testing. And you had to be symptomatic and in a high-risk group to even get a test. And we see more tests are becoming available now. In fact, we're able to help facilitate setting up testing at certain facilities. But private providers are also able to arrange testing through their own labs that they work with through their traditional channels. And, we're not always aware of every facility in every county that's doing testing. Sometimes they have supplies, sometimes they do not. Sometimes they do it as maybe a promotional type things, and then sometimes they quit. If we were to post our data for our district, if we had our employees call around and get that information, which would be a difficult, time-consuming thing, but if we did, it's important information, it would become obsolete within a day or two. So, we have, and we still encourage you, if you want testing, to check with your local provider first to see if they are and to see what their criteria are. If you go to your private provider, they will probably bill your insurance. That's been another question that's been asked often: is this going to be paid for? Well, a private for-profit medical facility is private and for-profit, and they're going to bill your insurance for it. Now, some of the sites that's getting the materials from the state, they may be testing for free, but some of the private places will not. So again, I apologize, I don't have a better answer. We are really strongly encouraging anyone that's doing testing to register on the Kentucky COVID-19 website. And that way, everyone in our public will have one consistent place they can go to check and see if testing is available in their community. So hopefully that will happen as more testing materials are available.
So Sean, we're linked to the Kentucky website where they could get that information if they came to our website, correct?
Yeah, when you get to our homepage, if you click the COVID-19 banner, it will take you right to our COVID page, and if you scroll down to the bottom, there'll be a link there that says additional guidance and information. It's right underneath that.
Okay. Are any of our counties planning on any more mass testing drive-through testing, do we know, Sean?
There are several counties actively planning that. Cumberland County just had some testing, drive-through testing.
The rest of this week.
They had it, and they've already started, and they're going to do it for the rest of the week. What are they doing in Wayne County? Are they doing drive-through testing in Wayne County? So Wayne County's got that up and going right now. I think Clinton County is planning it. We've already had some drive-through testing in Pulaski County. So again, as facilities get more materials, they're doing some more of that. Are you aware of any other drive-through things being?
Adair and McCrary are both planning for them.
And Adair and McCrary are both planning to ramp up some drive-through testing.
So it sounds like most of our counties are embracing that. That's all the questions I have, Sean. I'm not sure. Are there any on YouTube Live?
I don't see any. I've been watching. Just one person said, "Thanks for clearing that up." I'm not sure which comment they're referring to, but I'm glad they feel it's cleared up. Each day there's challenges about whether or not things are clear. You know, I know the governor talks about what's going to be opened, and that's good to give people light at the end of the tunnel. But then it's usually a day or two before any written guidance comes out. So things aren't clear for a few days, and businesses call us and want things to be clear, and we don't have the ability to clear it up for them always at the moment they want it. And you know, we've noticed that a lot of people, when they're interpreting the guidance, tend to interpret it in the way that you know suits them the best, and that's not always the correct way. So it's challenging, and you know, people want a lot of answers that we don't have. I know people are tired of being at home, and they want life to be normal again. And you know, certainly we could go back to normal, but if we did, this disease would run through our population very, very rapidly. It would take just a few weeks for it to get really to infect a large portion of our population. So hopefully we will all be safe and remember to avoid crowds and to stay home if we're sick, and to wear a mask, cover our cough, and all those kinds of things. Let's see.
Sean, there's one.
Yeah, I see. Oh, the issue with the prison was the thing that was cleared up. Thank you, Al. We have someone asking, can you go over the different types of testing? Is there a test that can tell if you are asymptomatic and have no symptoms? I'll let Dr. Wayman answer that, the two types of testing and what they're for.
Well, there are right now two types of testing. One is for the actual virus, RNA, which tells you that the person has the virus currently in their system, and that's the nasal swab. It's called a PCR test. And the antibody test, which can tell you if the person has or had the disease. An IgM, M for Mary, state occurs within about 7 to 10 days of onset of illness, and is considered an acute antibody response. An IgG, G for Gary, occurs much later, around 14 days, and lets us know that the person has had the disease and has mounted a immune response.
I don't know about Dr. Wayman, she can expound upon this, but I'm really leery of most of the antibody tests right now, because I don't remember if they are giving too many false positives or too many false negatives. There's been a lot of antibody tests on the market that, you know, unless they're specific to like 95%, they're not that valuable. You know, if they're giving you false readings 30% of the time, I mean, how confident can you be? And that's what a lot of the antibody tests. I'll let Dr. Wayman. I'm kind of talking out of my area, so.
You are right, and a lot of the tests don't actually tell you what the specificity is and the sensitivity. So they definitely have false positives and false negatives. So if you do 100 people who are asymptomatic and you get 5 positives, they're probably all false positives. So it's a difficult test right now to interpret. And the point of care tests are even worse. That's the ones where you stick the finger and get a result within 5 to 15 minutes. So the blood tests that are being done through the main labs are probably better, but they're not probably as good as the PCR test. However, that's all we have right now, and they're only authorized by the FDA and not yet approved, which means we haven't done all the right studies.
So
John is absolutely right. We're not always sure what they mean. If the person has symptoms, then they mean a lot more than if the person did not have symptoms.
So it's just another one of those areas where we're not able to give people the answers they want. People want to be told, here's where I go to get this test, and it's going to tell me definitively if I ever had this, I'm safe, I can go back to work. And, you know, the reality is, and people get tired of hearing this, and they don't always believe it, this disease has just been with us a few months, and there's not as much known about it. And it's, you know, we're seeing, you just watch the news. I mean, every day there's something new or some new symptom or some new problem associated with this disease. So there's a lot we're still learning. Let's see, we have, thank you all for your work and commitment to our communities. Thank you. All right, I think that's it, unless someone else has anything that they need to comment.
Sean,
Amy, Stuart, anything you all want to say about anything coming on?
Excuse me. Look in the chat box of Zoom. There's a question regarding if you don't care to share information about the scam that's currently happening across maybe our district.
Oh, okay. Well, that was something, apparently somebody or some group of somebodies is calling around asking or calling citizens in our area and claiming to be employees of the health department and asking, saying that they're trying to give you some supplemental insurance. And it's just a way for them to weasel private information out of you that you shouldn't give people. So, you know, no one from the health department is calling you to get any kind of private information. The only thing the health department would be calling you for is if you've been exposed to a case and we're letting you know that you need to quarantine. Nobody's going to be calling you asking you for your insurance card or your social security number or any private, you know, any credit card information or anything like that. So, you know, there's a lot of bad people that take advantage of bad situations. So make sure to protect yourselves, protect your identity and your privacy.
Okay, thank you, Sean. And again, do you all have any comments you want to share, Stuart, Dr. Wayman, Laura? No? Sean, do you want to close us out?
Well, I appreciate everyone taking the time to join us today. We've had 74, 75 people watching live, and there's usually quite a few people that watch the recording afterwards. And we hope these are beneficial to the community and keep you all informed. And we will continue to try to have these weekly, at least for the foreseeable future until the COVID-19 situation starts winding down. So again, we thank you for joining us.
Thank you. We will see you all next Wednesday. If you have questions, please send those in. Have a good day.